All right, now we've finished counting, so I'm ready for my surgeon to come in the room and we'll begin that process. So I'm gonna go ahead, unfold my towel lengthwise, drip it over their hand. Hello, Doc, my name is Elliot Wagner. I'm a surgical technology student at Southeast Community College.
Nice to meet you.
Nice to meet you. Go ahead and grab the right glove. Left. Would you like to spin? All right, now I'm going to come over and go ahead and put my flat pulley drape on top of my basin with my 4 square offs. Okay, and I'm going to go ahead and bring these up towards the edge of the bed here. Okay, and you can prepare these before, you can prepare them now. Either way works. Okay, so I'm going to go ahead and use the same concept here. So starting off still with the edge closest to me. Remember, we're going to need a wider area to accommodate our trocar sites with laparoscopic compared to laparotomy. Okay, so we'll keep that in mind. And then my last one's going to go on the other side, so I'm going to go ahead and again move my basin back that way, face the unsterile portion remaining 12 to 18 inches. And I'm going to square off this last side here. Once I get to this point, I'm going to go ahead and turn towards my basin, and then I'm going to go ahead and grab my lap pulley drape. Would you like the stickies on or off?
Let's leave them on today.
I'm going to go ahead and center this and do that portion. We're going to go ahead and unfold it toward ourselves. And again, always starting with the foot of the bed first. So cupping our hands, extending towards the foot, releasing, and then same thing towards the head. Always protecting our hands. Now I can bring up my cords here. I'm going to go ahead and hand my surgeon a light handle while I do the other. Turn on, point at the incision. And now we're going to begin doing our cords. Okay? So my first cord is going to be my insufflation. Okay, so we have our filter end. So the filter end is always going to go off the patient. So make sure you're paying attention to, again, where the boom is at, okay? And then this kind of feeds through our pockets here, so I'm going to go ahead and secure our cord using our cord management here, okay? So I'm putting my insufflation, camera, and light cord towards the foot of the bed. The reason behind this is all going through the umbilical trocar, so that's why I'm doing it on the foot of the bed. And I'll explain the other cords here in just a second. So I like to grab a couple coils, and then I'm going to go ahead and place towards the foot of the bed while I hand off the cord remaining my distance from the circulator. Again, just feeding this through the pocket here. And then I'm going to go ahead and grab my fiber optics. Same thing, I do about 3 coils, leave on the field, and then the rest I'm going to hand off. My next cord is going to be my monopolar cautery cord. So this is going to go up towards the head of the bed. And the reason behind this is, again, this is going to be used for the doctor, so it's going to be more tending to their hand rather than me. I like to secure that just through one Velcro, or you also have Velcro straps up top as well. Okay, the next one is going to be my suction irrigator. So this is also going to go off towards the head of the bed. So I'm going to go ahead and grab both the battery portion end and the suction end that's gonna go off to my circulator. So I don't wanna drop this on the floor because it has that end that we're gonna use to spike under the bag, so I don't wanna drop that on the end or on the floor and possibly risk contaminating that spike, okay? So once I have attached all my cords, I'm gonna go ahead and move my basin back and then bring up my Mayo stand. So same concept, so I'm gonna kind of drag it forward here. And then I'm gonna come, once I get plenty of distance from my back table, then I can come to this side. I'm gonna go ahead and raise it up and put it over the foot of the bed. Okay. Now since I'm here, I'm gonna begin attaching my cords. So I'm gonna first place up my Ratex. So I put one at the head of the bed, one at the foot. And then I have my thread, which I'm gonna stick towards the foot of the bed near my camera. Okay. Then I'm gonna begin attaching all my cords. So my first one here is that I suction. And you can use the pockets to your advantage, so I kind of like to put that tip down like that, and then I have my J hook here that's going to attach to my gray cautery cord here. And same thing, I'm going to go ahead and just place this in the pocket, being careful not to stab it through the pocket as well, as you can see just here. Okay. Next is my scope and my warmer, so I'm going to go ahead and attach this. So the scope is going to go ahead and attach here, so this just screws on, just like you've seen before. And then my camera, I'm going to go ahead and push this lever here and attach it just like so. Okay? Before we proceed forward, I'm going to go ahead and white balance. So I'm going to go ahead and put a little bit of defogger on, and then I'm going to ask my circulator to go ahead and turn on my camera, or my light source. So once they say light source is on, I'm going to go ahead and hold my white, which is on the right side. And then once I get white balance complete on the screen, I'm going to go ahead and ask them to turn it on standby. Can you turn on standby, please? Thank you. Once they turn on standby, then I can go ahead and place it back in the warmer, and that's ready to go. Okay. Now I'm ready to go ahead and bring up my back table. Keeping my hands nice and flat. You can always reposition, and then grab my basin, keeping my hand inside. Okay? All right. Now I am ready for the case to begin.
Have we done timeout?
Timeout has been complete.
Okay.
Okay.
And verbal is going to be my safety zone with my Mayo stand.
Okay.
Sharp.
Sharp down.
Thank you. Okay. And then, would you like?
I'll take a stitch.
Okay.
Now that we have completed.
Okay. Right to right, left to left, and then I'm going to go ahead and anticipate suture scissors. So remember, we're using tissue forceps with teeth because now we're closing the fascia. Okay. So I'm ready to go ahead and do my closing count.
All right. Ready when you are.
Okay, Ratex. I have 1, 2 up on the field. Here is 3, 4, 5, 6, 7, 8, 9, 10.
10, yep.
Atraumatics. I have 1 working with the surgeon here. Here is 2, 3, and 4.
4 is correct.
Okay. Knife blades. I have 1 up.
Yes.
Okay. Syringes. I have 1. Hypo. I have 1.
Yep.
Marking pen. I have 1, 2, 3.
Yes.
And then lastly, Fred. I have 1 up with my sponge, and then here's 2, 3.
Count is correct.
Count is correct. So now I'm going to go ahead and bring up my local as the surgeon throws their last stitch.
I'll take some local, please.
So I'm going to secure my needle first. I'm going to go ahead and place that in my needle book. And then I'm going to go ahead and get my lidocaine ready. So I have 1% lidocaine with epinephrine, 1 to 100,000.
Heel down.
And then we use 2 cc's.
2 cc's.
And lidocaine is a local anesthetic and for use for numbing, and then epinephrine is a vasoconstrictor used for hemostasis. That's it.